Welcome to the SCR Connections May webinar. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Matthew Martin. Matt is a researcher at the Kirwan Institute, where he focuses on housing and transportation policy, neighborhood revitalization, and the history behind regional inequality. He produced the Institute's award-winning documentary, Free to Ride, and has conducted community assessments with partners around the country to help them understand spatial patterns of vulnerability and how to make their communities more sustainable by improving access to opportunity for their most marginalized members. Prior to joining the Kirwan Institute, Matt was a regional planner with the Miami Valley Regional Planning Commission in Dayton, where he worked on land use policy, transportation planning, and regional development. He has also worked in local planning departments in Kettering and Piqua, where he assisted with development planning and zoning code enforcement. Matt holds a BS in Urban Affairs and a minor in African and African American Studies from Wright State University, as well as a master's in city and regional planning from the Ohio State University. I'm now going to hand over control to Matt and let him get started. Welcome.
Thank you, Brian. And thank you for the introduction. If you had a chance to read the article that was sent out beforehand from the Atlantic's City Lab about why housing policy should be health policy, you'll have a little bit of an idea of where we're going to go today in the webinar. I want to talk about housing policy, community development, and public health, and how collaboration across these fields could help address some of our biggest problems more effectively. So I pulled a couple quotes from that article to include in this slide, and it really captures what I think is the essence, what I hope to be the essence of our time together this morning, where we see that public health folks and housing folks are often working on similar things without even acknowledging it or recognizing it, and so they're missing out on opportunities to work together and to work in conjunction with one another on the challenges that they are seeking to address. So for today, I want to go through this in this fashion, where we'll start by looking at why health outcomes have a spatial and a racial footprint. Why can we map health outcomes, and why is there so much racial disparity as well in health outcomes by place? We'll talk about why place matters and how that shaped the current landscape of inequities in health outcomes. And we'll talk about that in terms of both housing and health and transportation and health. So the reason we're going to look at both of those is because housing and transportation are really they have an intrinsic relationship with one another, and health equity is reflected in both of these domains when we think about community development. And so I think that they represent big opportunities for collaboration in the public health arena, and then we'll close with some discussion, and we'll talk about how we can foster more collaboration, and I'll give some examples throughout the webinar as well, some stories about how different communities have worked together and begun to tackle public health issues more collaboratively. So if you've read Malcolm Gladwell's Outliers, you are familiar with the metaphor that he uses, the ecological metaphor of the tallest oak tree. And it really reflects this notion that, you know, we're becoming increasingly aware of the spatial differences in life expectancy, for example. But I think similar to how we don't often know enough about the sunlight that warmed seeds, the soil that trees grow in, the things that they do or do not face as they continue to grow. I think we're still slow to understand the underlying causes of the disparities in things like life expectancy and infant mortality and why they're so place-based. So we know that there are these disparities, but we're still really at the beginning of digging back into the causes and why they're so place-based. So when we look at cities across the country, for example, we see that these patterns are consistent and that they have been persistent over time. So in city after city and regions across the country, we see these disparities, and again, we're left to ask, how did these take shape? Why, not only why are there disparities, but why can they be mapped so easily? Here in our home city of Columbus, Ohio, we've done a lot of local research, and in theme after theme, map after map, we see these similar patterns. So whether we're looking at infant mortality, access to opportunity, access to food banks and who's using those food banks and where they live, whether we're looking at incarceration rates, criminal justice, engagement, and where the highest costs are associated with our approach to justice in Franklin County, or whether we're looking at vulnerability among seniors. Who are the most vulnerable seniors in our community and where do they live? Or life expectancy. No matter what it is, we're seeing similar patterns in all of these maps. And again, it causes us to ask, how did we get here? So this is why we, at the Kirwan Institute, do so much work around place and trying to understand why place matters, the impact of place. And we know that there's emerging research around trauma that reveals the impact that it has on biological and psychological health, and thus achievement and life outcomes. We know that stress plays a significant role in that, and that trauma and place can be clearly linked through the mapping of things like infant mortality, crime, and life expectancy. And so we know that place really matters, and we know that opportunity matters, that opportunity is something that when we think about it, there are 10,000 different things that may come to each person's mind when they're thinking about what opportunity is, and depending on the context. But it certainly means more than one thing in the context of community and place and environment and where people have the best chance to thrive. And research has shown time and time again that it's really a combination of factors that make a place opportunity rich or opportunity deficient, and oftentimes where one of these aspects is strong, others are strong as well, or vice versa. So we know that a strong educational pathway, strong schools, and educational opportunities are really important. We know that stable housing, affordable housing, is really important. Access to quality health care is a critical element of opportunity. Having living wage jobs and having access to those in all of the ways that we think of access. And then having effective transportation, transportation options, affordable, safe, all of these things together make up sort of the opportunity infrastructure or ecosystem within a place, and they're all important. The Kirwan Institute, a little over 10 years ago, actually pioneered what's called opportunity mapping now, and it's based on some of these principles that space and place and life outcomes often correlate, and that access to opportunity really matters, that it's often spatial, and that we're situated in any given place within opportunity structures. And so as the last slide illustrated, there's not one mere element to opportunity. It's actually an arrangement of opportunity structures that make a place what it is. And so When you think about the metaphor of a bird cage, it's not one single bar that keeps the bird caged, it's multiple bars and the arrangement of them that keeps the bird caged. And so when we think about opportunity, we recognize that it's the arrangement of multiple systems and structures that create the opportunity landscape. We also know, again, that they're not just spatial, it's not just place-based, but because of how our cities were planned and developed throughout the 20th century, that we also see a racial footprint of access to opportunity. And oftentimes, all the systems and the way that they interact with one another, they create feedback loops that either perpetuate achievement and life outcomes for good, or they create a continued cycle of poverty that makes it very difficult for people to get out of and to get not just out of the situation, but even out of those places and the neighborhoods that, because of disinvestment, have really trapped people in those circumstances and in those places. And so these are the principles that have gone into and shaped the opportunity mapping work that we've done and the way that we have advocated for opportunity maps to be used over the years to both incentivize housing mobility so that people can move to places where opportunity exists, and to incentivize investment in opportunity structures and developing those in neighborhoods where they've been historically disinvested in. So when we think about opportunity and we think about it in terms of place, there are so many aspects of it, but we often know it when we see it. And we can tell when a neighborhood is opportunity rich or opportunity deficient. And those things, as easy as they are to sort of recognize at times, they are much more complicated to work on and improve and invest in a comprehensive way. And so that's why we think collaboration across different domains and fields is so important, and why housing folks and transportation planners and policymakers need to be working alongside public health folks and vice versa. So I want to start by giving an overview of how we see housing and health intersecting, and then we'll go through some examples and talk about that, and then I'll do the same with transportation. So when we think about housing and health, there are a number of different components to that. So there's the habitability and the health of the actual structure itself, and then there's the whole aspect of affordability and being able to financially, sustainably live in a home, and the stress that housing cost burden can create and the impact that that can have on health as well. And then lastly, we see that the impact of neighborhood and the environment around the actual housing structure is really critical, and that in neighborhoods that have high vacancy often experience blight and have, as a result, a lot of public health issues, exposure to different toxic materials, be that mold or lead, or if their proximity to industrial areas is high, then there's any number of toxic substances that can be in the environment that can have a real health impact. And so we like to think of housing and health comprehensively, and these are three main areas where we see those relationships. So as I kind of alluded to, there's a host of different things to think about when it comes to housing and health, and many of these things we can look back throughout the history of cities and the way they developed We can look at the history of neighborhoods and the kind of investment and the kind of policies that shaped those neighborhoods. And many of the things that we see today that represent the relationship between housing and health, we can trace back to those times, to even not just the early 20th century, but even the late 19th century when we think about some of our older cities. So I want to actually start by providing some historical context for the forces that shaped housing and neighborhood development throughout the life of our cities. And many of you may recall the early influences of public health on city planning and urban development. That some of our earliest city planning initiatives were in fact related to public health, whether it was the addressing epidemics that were breaking out in cities, responding to disasters like fires or floods or earthquakes. Public health was really one of the first drivers of city planning and policy making, and even community planning efforts that were, many of these were about promoting healthy living, and many of them focused on light, air, and water, all things critical to a healthy community and healthy life outcomes. So a lot of early planning efforts that we can look back at involved community surveys. They were oriented around parks and green space and promoting public health through that and through healthy civic spaces. And we can look back at a lot of these plans and also see how slum clearance was a big part of them. That public health concerns at that time were often addressed through slum clearance and the construction of newer, better organized housing and neighborhoods. But even in these times, we can see the earliest of city planning endeavors were wrought with social and racial inequities. And that's most notably characterized by what we all know today as redlining. But redlining was really just it sort of is a symbolic representation of a lot of racialized housing policies that were developed in the early 20th century as our cities continue to grow as a result of industrialization. And so we also see then, and I'll highlight this more in the next slide, but we see this transition happening in planning and housing development from a public health fueled initiative to one that focuses more on architecture and then focuses more on real estate and development. So what I want to do now is just kind of take a minute to talk a little bit more about redlining and the things associated with that era, and lay the groundwork for a better understanding about how these policies and these forces shaped the public health trajectory of the 20th century. So if you are not familiar with the Homeowners Loan Corporation, it was a federal policy that was initiated in response to the stock market crash of 1929 and the Great Depression. And it was intended to stave off the foreclosure crisis, to spark more housing construction and job creation, and to promote higher home ownership. The problem with the implementation of this policy was that the way that we thought about risk, neighborhood risk, was very racialized and was very class-based. So the way that the policy was actually implemented is that real estate experts in cities across the country, over 200 cities, would assess their cities neighborhood by neighborhood, and they would take, they would take very detailed notes about neighborhoods and what characteristics were exhibited in those neighborhoods, the age of structures, the condition of housing, things like the schools and the transportation system. But one of the most influential characteristics of these assessments, and we can tell this directly from the notes and what the assessors were thinking, is the people who lived in those neighborhoods. And not only was real estate and investment risk thought of in a very racial way, but public health was as well. And so Negroes and immigrants were thought of as a threat to public health and a threat to property values. And as such, the neighborhoods where immigrants and Negroes lived at this time were what we now refer to as redlined, meaning that they were given the lowest rating in this system of rating that would be reflected in the federal government's insurance of mortgages at this time. And what we would see about the A-rated places, or the low-risk places, is that those were often marked by newer development where there was more green space, bigger lot sizes, professional classes of white residents. And those were the neighborhoods where we see the federal government insuring mortgages throughout the 20th century. What this did was it put into the DNA of our cities from a very early point that investment would be place-based and that it would be, in many ways, race-based. And these maps often worked in conjunction with what are known as race-restricted deed covenants. So in neighborhoods that were A-rated in the Homeowners Loan Corporation maps, one of the definitive characteristics of A-rated neighborhoods was that they had what the assessors referred to oftentimes as protections or strong protections, meaning that homes in those areas had restrictions built into their covenants that said that this home could not be sold to anyone who was not white. And so what happened was, through the federal government's mortgage insurance program, through these deed restrictive covenants, places where Negroes and immigrants lived at the time were systematically disinvested in, and simultaneously those groups of people were cut off from moving into the neighborhoods where the investment was going. And so you see, again, at these very early times, the ingredients in the DNA of what we're now looking back on and seeing the impact of in racialized spatial disparities in health outcomes. So again, when we look back over the last 100, 150 years of city development, we see this early influence of public health on how we approached planning our cities. And really with the World's Fair in Chicago in 1893, we see a turning point where architecture starts to take more precedence over public health, and the design of civic spaces and parkways begins to inform planning more. And then another turning point happens in the late 20s and early 30s as a response to the financial crisis, the Great Depression, wherein after that point, real estate investment, the mortgage market, the insurance market, and mitigating investment risk really shape neighborhood and housing development for really the rest of the century. And the question that this raises for us today is, how can we rebuild those connections that nearly a century later? So how can we know that city planning and public health were intertwined with each other in the earliest parts of our city's development. How can we get back to a public health mindset when it comes to housing, city planning, and transportation? So, for example, a model that a lot of planners use today, a lot of planning departments are using as they think about their zoning code or their building code, is what's called the transect. And it really is based on the way we see gradual changes in the natural environment. We see that reflected also in urban development. And even though because of sprawl over the last several decades, there's not always a really smooth transition in the urban environment. It represents this opportunity for us to think more, to think about things like the transect model and our urban form from a public health perspective and not just from building design and development form. So how can we begin to really do that, and what are our opportunities to influence the thinking around that? So a lot of researchers are beginning to map public health data in light of housing patterns, both historic and contemporary housing patterns. And what they're revealing through this work is the undeniable intersection between these historic policies, between real estate and housing and public health, and that these things that shaped our cities also shaped our current health disparities. And so in this example, we're looking just at the toxic release sites in Cleveland, and we see the relationship between where those are and the places, the neighborhoods that were deemed high risk in the 30s and subsequently disinvested in the decades that followed. We can also look at things like infant mortality and see the relationship between infant mortality and housing in neighborhoods. And those rates are often also higher in neighborhoods that were systematically disinvested in throughout the 20th century. We can look at diabetes. We can look at all manner of health outcomes for which we have place-based data and see similar patterns. And what it does is it allows us to begin thinking in an interdisciplinary, intersectional way, and it begins to help us have conversations across these different fields and domains, asking, what have we been missing? What have we not been seeing? And how have we not been working together in ways that we should? Again, we see that these patterns are not only spatial, that we can map them, but we still see a persistent correlation with race and class. And again, I go back to the redlining maps and the ways that those they baked in place and race into our earliest policies, and so it's really no wonder that we can map these things today and see such correlation. Here's an example of some of our work outside of Ohio, and I pulled this as well because I know that many of the folks on the webinar are probably from Texas, Louisiana, these areas, and so Dallas might resonate as an example where what we did a couple years ago through some research in Dallas was we looked at the 1937 redlining map. We looked at some current data on home values, for example, and noted that current home values, almost 100 years later, still reflect a lot of the early redlining geography. And we can see the racial footprint of it as well, still in Dallas. We can see it also when we look at things like years of potential life lost, that also reflects the way public health risk was thought about in the 1930s and how it was cooked into our policy. But I want to give an example of how we can start to move forward in light of these. So it's important for us to begin to look at data differently and to begin looking at health data in conjunction with housing data. But where do we go from there? Once we start those conversations and start looking at data differently, what can we do about the things that we start to see and the connections that we start to make? And so one recent example of this kind of collaborative approach happened in Toledo, Ohio, where researchers from the Kirwan Institute worked with public health officials in the Toledo area and community organizers and legal aid attorneys to go to Toledo's City Council to come up with a policy solution that can start to address these in a more systematic way and not just a clinical approach, which is obviously still important to maintain, but what the result was Ohio's first city ordinance requiring landlords to adequately mitigate lead and other environmental hazardous issues in homes before they rent them to families. And while this may seem like a really natural thing to have had built into our codes and ordinances, it's really not, because of how we've failed to look at the intersection of health and housing for however many decades now. And so this represents one really promising collaboration and a promising policy outcome that we hope, when enforced, can lead to better health outcomes. So what you're seeing in this map is the blood lead levels in children across Toledo's neighborhoods. And what we see with those levels is that they highly correlate with the neighborhoods where houses were built and thus painted in before lead became an illegal substance in the building of houses in the 1970s. So where houses were built before then is where we see these high blood lead levels, and this was research that informed these conversations and the development of this ordinance. And so we're hoping that this will be a model now, and that cities like Cleveland and Cincinnati and Columbus will follow suit. So now I want to take a look at transportation and look at transportation as well from a public health perspective, because we know in as much as place matters, no one lives stationary lives, that we're always moving to go to places of work, places of school, places of worship, places of recreation. And so when we think about housing and health, we also have to think about transportation and health. And again, a comprehensive approach to understanding that begs that we look at a few different aspects of how transportation and health are related. So for one, safe navigability, through spaces is an important part, and it's really one of the most immediate aspects of how transportation and health are related. So in the picture that you see there, this is someone who's walking over this really busy highway overpass where there are no sidewalks, there are no crosswalks, there's no signals for pedestrians, and this is something that people in many cities have to do either because there's no public transit, or there's no sidewalk infrastructure, or there is public transit, but it doesn't serve all the areas where people need to go. And so when we think about the safety and safe navigability of transportation, we think about it not just in terms of pedestrians, but also cyclists and automobiles and and the lack of, or the threats to public health and public safety in this area and this way of looking at transportation are ever present. There's also toxic exposure. So just as with housing, certain modes of transportation and certain spaces expose people to exhaust, to poor air quality, potentially poor water quality, and it's not just people who are traveling, say, on foot through a congested area. It's also congested areas traveling through neighborhoods. So when we think about the interstate highways that we built through neighborhoods in the middle part of the 20th century, that was a transportation investment that had an impact on neighborhoods and subsequently public health in those neighborhoods. And then lastly, again, if folks can't afford a car, or affordability is a stressor when it comes to the cost of transportation, then that too becomes a separate public health issue. So I kind of went through this, but when we think again about environmental exposure, for example, whether it's rail yards, highways, airports, industrial waterways, all of these can represent a public health problem in communities. So again, it's not just what you're exposed to when you're on the move, but the exposure that when everyone else is on the move, can have to you and where you live. And again, the psychological impacts of a lot of this can't be overstated either. Again, this is just a picture that kind of illustrates some of these components, and these exist all over our cities and all over our regions, and so it's not just something that a few places in our cities are subject to. I want to give an example of some of our some other recent work where we've been doing some mapping in Birmingham, Alabama, to highlight the disparate impact of a freight rail expansion through a historically African-American neighborhood. And what this example illustrates is that not just the health threats posed through transportation infrastructure, it's an environmental justice issue, because a lot of times the neighborhoods and the communities who are at the mercy of some of these public health problems often have less political power to push back on city council efforts to attract corporate investment in the community. And so this, I think, as much as any example, illustrates the need to make sure that you're building alliances and partnerships with folks from other fields to do things that maybe you as a public health official cannot. So in this instance, legal aid really needed to get involved to defend the rights, the constitutional rights of this community, because they were not asking for CSX to expand their freight rail load through their neighborhood. This was being imposed upon them, and their city council was not defending their constitutional rights. Their city council was advocating for this expansion because of the business and the at least theoretical job growth that it was going to bring to the community. And so, again, be thinking about who in your community you need to start talking to and working with to address some of these public health concerns. I talked about this briefly a moment ago, but this picture really illustrates better than a lot of words the disruption, the public health disruption that some of our transportation infrastructure can cause in a community. And a lot of times when we see these kinds of examples, we recognize that the planning and engineering of such investments have often not equitably balanced the costs and benefits. So when we think about, who is incurring the costs of these sort of investments, these projects, and who enjoys the benefits of them, they're often very inequitable, and the costs are also long-term and ongoing for many of these older urban neighborhoods through which highways have been built. And it severs these neighborhoods not only from downtowns and economic centers, but also cultural centers. And so what you're looking at in this picture is the historic Near East Side in Columbus is the heart and soul of the African American community, and this church was sort of the heart and soul of that neighborhood. And the highway, Interstate 71, was built between that neighborhood and downtown, and that neighborhood and this church. And so they're now on opposite sides of the highway, and for the longest time, very separated and cut off from one another, and along with a host of other things that happened with policies throughout the 20th century, really marked a lot of the decline of the neighborhood. And since then, a capped bridge has been constructed to try and reconnect the neighborhood to this church and downtown Columbus. And I think it represents sort of a double-edged sword when we think about this work, because we can begin to make strides to repair and restore these broken relationships between neighborhoods like this and the rest of their cities, but we have to recognize that we can't undo the past, and that we have to continue to strive to do more than just offer token measures of justice. So here's another look at that, and you kind of see, in addition to this cultural wall that celebrates the heritage and the history of this community, on the other side of the street here, there's a park, which again is a powerful symbol, but this kind of work needs to go beyond just powerful symbolism. I want to share another example, a story that will illustrate a potential collaboration in your own community. And this story is the basis for the documentary that we recently produced called Free to Ride. So there was in the Dayton, Ohio area, there was a suburban community that was sort of on the outskirts of the region's transit service. So folks were having to get off the bus and walk a little over a mile to get to their destinations in this thriving suburb, where there is a regional mall and shopping center, a community college, a brand new hospital, a STEM high school, and a lot of retail development. People were getting off the end of the bus route and walking not just a mile, but a pretty treacherous mile, particularly in winter months, over this highway overpass to try and get to their destinations. And what had sort of been accepted as just normal for so many years as this suburb rapidly developed throughout the 80s and 90s as a result of the construction of Interstate I-675, actually stood out to a group of community organizers when they caught word of this. And so in 2009, roughly, there's a faith-based community organization in Dayton who every year gets together and seeks out problems in the community, injustices, by listening to community members share their stories, their testimonies of things they're facing. They heard the testimony of a couple Latino women who were making this walk every day to and from work, and one of them was even pregnant during this time, and so was sharing her experience of walking over this overpass you know, at night, you know, when the snow gets plowed up against the, you know, the side of this overpass and pushes her out further into traffic. And so they saw this issue and realized they had to do something about it, that it was, first of all, probably a civil rights issue, because people do have the right to go anywhere in this country, and buses do have the right to travel on public roadways. But you know, at the very least, this was a huge public health crisis, and there are examples, instances all over the country of situations like this where people have been hit by cars, have been hit by buses, tragically, and we even see when we look at fatalities and injuries, pedestrian fatalities and injuries, that there is a disproportionate rate of people injured in these kinds of instances who are people of color. And so not only is this a huge public health crisis, but is also a racial and economic injustice at the same time. So this community goes to the Transit Authority, points this out, says this has to get fixed. There's an easy solution to this. Put bus stops on the other side of this highway so that people don't have to walk over this bridge anymore. The Transit Authority had actually been looking at this area for about 10 years, looking to expand their service to this area. They saw this as an opportunity with community support to go and do it finally. They presented a proposal to the Suburban Jurisdiction's Public Works Department, worked with them for a number of months to develop a proposal that complied with all of that city's ordinances, and had a proposal that did comply, was in compliance, took it to City Council, and that's where the wrench kind of went into gears. And this City Council sort of, they tabled it a number of times, and eventually they voted 6-0 to deny the Transit Authority's proposal that completely met their ordinances. At that point, this community organization was not about to take no for an answer. They connected with legal aid attorneys, and they eventually filed a Title VI civil rights complaint to the Federal Highway Administration, which did almost a 2-year-long investigation and found that this Suburban Community Council was in violation of the Civil Rights Act and that they needed to go back through their process and do it in a non-discriminatory way. Those buses have been running now along that corridor since January of 2014. Crime has not increased in that shopping area. There have also been no pedestrian fatalities or accidents, and people are just going about their business and going about their lives, and this major health threat has now been mitigated to a very real extent. That is what we have called a morsel of justice as we were working through the production of the film. But it's a powerful story. It's a powerful victory of collaboration and people coming together who maybe didn't traditionally talk to one another or work with one another to address a civil rights infringement, but also a public health crisis. So I want to close with just pointing you to a few resources, and then we can begin to take some questions. So one of the things we look at when we think about housing and transportation together is what's called the H+T index. And this is something that has been around for a number of years, and it provides data and mapping for communities all across the country to begin to look at the relationship between housing and transportation. What I would also suggest is pairing local data on maybe traffic accidents, on anything you can get your hands on related to health, whether that's health outcomes like diabetes or asthma, and start to look at that data in conjunction with data like the H+T index. So here's a list of some of our favorite resources to recommend as people are getting started. There's a national database of these redlining maps housed by the University of Richmond, where you can get oftentimes not just the map, but also the assessment notes that shaped those maps back in the 1930s. And those, as much as anything else, can really begin to spark conversation in your community about the relationship between today's health disparities, health outcome disparities, and our housing policies. And a host of others here, the life expectancy maps developed through the Robert Wood Johnson Foundation and the University of Vanderbilt are obviously a really valuable resource in the cities for which those have been developed. Many of the cities in your region, in Texas, Oklahoma, Louisiana, Arkansas, and New Mexico, have those redlining maps available, and some of those cities have had life expectancy maps. Think of those again as, if nothing else, as conversation starters to help get different folks to the table who maybe you haven't thought about working with. And then lastly, I'm going to type in a link to where you can access the Kirwan Institute's public health work, so you can see more examples of where you can go with this work and how you can think about starting collaborative initiatives in your community. So with that, I'll kind of turn it back over to the group and to Brian, and we can maybe have some time for discussion and answering questions.
Great. Thank you, Matt, for that fantastic presentation. You know, if you have any questions, go ahead and type it into the chat box. I see we have one already. So a portion of our audience are definitely librarians and other information professionals. And this person asks, so how can we as librarians make a difference in these areas? This person is graduating with their Master's of Public Health on Saturday. Congratulations. And would love to combine their 2 degrees. What would you suggest, Matt? Matt, are you still on the line?
I was muted, sorry.
Oh, no problem.
I'm typing in my response, which is that librarians are the ones who helped us acquire all of Ohio's redlining maps so that we could start to analyze them and use them in these kinds of conversations to spark collaborative efforts like we've been doing. So if for nothing else, helping communities acquire these historic documents that give clues to the roots in the DNA of how communities were planned is one really powerful way to help get things going in your community. So, and I'm going to send a link to that work as well.
So we have another question here. Were the redlining maps typically done only for large cities?
They were done for almost 300 cities across the U.S. So for instance, if you look at the link that I just shared of the redlining maps in Ohio, those maps were made for, obviously, Cleveland, Cincinnati, Columbus, but also Dayton, Toledo, even cities like Portsmouth, Lorain, Lima, Warren, Youngstown, Hamilton. So a lot of even mid-sized cities, small and mid-sized cities, had these maps. And the biggest bank of or collection of all of these maps is on that University of Richmond link that I have. It's the first link in the additional resources. And I think you'd be surprised at all the cities that we have those maps for. But what I'll say is that even if your city's map is or is not on that Richmond website, that doesn't mean that it doesn't exist. And again, that speaks to the role that librarians can play to help unearth a lot of these archival resources, is because sometimes they are buried. And if you like challenges, and if you like the challenge of finding things at different National Archive locations and finding the notes that are associated with those maps and really trying to get those in people's hands, that's a powerful way that librarians can help serve their communities and start this kind of work.
Yeah, I definitely know a couple people. I think I see a couple people participating today that could answer this question as well. But definitely finding all of that data, up-to-date data, can be hard to sift through. So I could also see that as a real potential role for librarians to help compile that data and really use their unique skills to find it. From having done some of that data collection work myself, it's really difficult to find sometimes.
Yeah, and I would say that we're still only scratching the surface with these maps and what they represent. I mean, I'd say in the last 2 or 3 years, there's been an enormous amount of work done to unearth these maps, find them, make them accessible on the web, like what the University of Richmond has done and what Ohio State University libraries have done. But that's really just the beginning, because now that people have them, there's all kinds of research that can be done with these spatial research, but also if you have the area descriptions, you have those notes, there's a ton of analysis that can be done on those, from anything from as simple as doing like word cloud research to show what were the terms, the language that was most prevalent in those notes that maybe had the biggest impact on the ratings of neighborhoods, to even deeper dives where you're digging into the content and trying to make a lot more sense of it. And that's definitely, Brian, where librarians have an opportunity to weigh in and provide some additional value beyond just finding the maps.
Great. Thank you, Matt. It was a real pleasure to have you with us. I'm going to go ahead and stop the recording now before a few final housekeeping items.